my name is Jackie Strohm, and I am going to be presenting my Educated Citizen portfolio for the Accelerated BSN program at Nebraska Methodist. So, my public issue that I was able to work on this whole quarter was actually centered around gonorrhea rates in Nebraska. In the United States alone in 2021, there were 710,152 cases of gonorrhea reported in the United States. Nebraska, more specifically, there were 3,474 total cases reported. And in Douglas County, to get a little bit more zoomed um, in 2020, there were 318.6 cases per 100,000 people in the population that were reported in Douglas County. So, gonorrhea is actually the second highest STI that is reported in Nebraska. And going along with that, what is kind of becoming a large problem with stopping the spread of gonorrhea is the fact that there is no mandated legislation in Nebraska requiring sexual education classes to be taught in Nebraska public schools. So there are so many adolescents in Nebraska that are not being taught sexual education, and therefore their knowledge of safe sexual practices are quite diminished in some areas. So it's my belief that all adolescents should be able to receive fact-based preventative sexual health education. And that's kind of what I was able to dig into this quarter, which was really great. So, along with our public health issue that we were able to pick, we've also experienced a lot of very beneficial interactions throughout our time as students here at Nebraska Methodist. All of these interactions kind of contribute to becoming an educated citizen. So, an educated citizen is an effective communicator first, and Nebraska Methodist defines an effective communicator as someone who uses critical thinking to generate, connect, and organize ideas in a written, oral, or nonverbal manner. My first experience as an effective communicator, I was working on 6 North on a Nebraska Methodist main campus, and I was working with a patient that had Guillain-Barré syndrome. So he was paralyzed from the neck down, essentially on a ventilator. He was trached, and he was not able to verbally or physically communicate with me. And throughout the process of taking care of him, I learned that he could actually communicate with his eyes. So if I asked him a question, he could open his eyes really wide or he could shut his eyes really tight, and kind of provide me with a yes or no answer to my questions. So the lesson that I learned through that interaction was that nonverbal communication can be just as valuable as verbal communication, and that I need to be able to adapt my communication styles when working with various patients and communities. This application can apply to tailoring communication styles when working with adolescents with Nebraska sexual education. So you need to be mindful of the population that you're working with, and then tailoring your communication style to best affect how you can interact with those individuals and provide the best care. My second effective communicator experience was actually on 7 South at Nebraska Methodist Main Hospital. I was able to shadow a charge nurse on the acute care floor for elders, which was really great. We did so many things. She was in charge of scheduling for nurses. She was in charge of rounding on the entire floor, discharges, intakes. She went to staffing meetings. And then throughout that whole process, we were helping nurses on the floor if they were kind of getting overwhelmed with patient needs, hanging IV medications, giving other medications out, helping with like toileting and everyday cares as well. So the important lesson that I learned from that experience was the importance of being a strong leader and using effective communication styles to accomplish group goals. If that team was not able on the floor to effectively communicate, it would have been pure chaos. So it's very, very important to be an effective communicator. The application with this to sexual education and gonorrhea rates in Nebraska would be coordinating and organizing sexual education programs around Omaha. So if you're going to be working with different organizations like Planned Parenthood and Nebraska AIDS Project, you need to be able to be an effective communicator and a strong leader to be able to bring everybody together. On to reflective individuals. So, Nebraska Methodist defines reflective individuals as those that routinely engage in habits of inquiry that influence ways of thinking and actions. So, my first reflective individual experience occurred on 7 South again, that acute care for elders floor. And I was actually working with a patient that was diagnosed with stage 4 pancreatic cancer. Not long ago, actually 2 years ago, my dad was actually diagnosed with pancreatic cancer, and we had spent time on that very floor taking care of him. So it was a little bit of a different experience for me to now be there working on the floor and kind of having to really account for my own emotions and feelings that I had while I was on that floor as well. So the lesson that I learned is that we need to reflect on our own experiences when providing care. Um, and it actually really helped me become, I think, a better nurse in the way that I was able to relate to that family. The application for this would be applying this attitude to how we approach sex education in Nebraska. I think we all need to remember the time where we really didn't feel like we knew much about sex education, and how we might want to be treated when learning about sexual education. I think it's so important to reflect on our own experiences when we're trying to help a new generation learn. Reflective individuals. My second reflective individual experience was at Nye Legacy, which is a skilled rehab facility in Fremont, Nebraska. I experienced working with a disgruntled patient that was recovering from a leg amputation. So he really did not want me to be around him, to be helping him, to be in his room. And I very easily could have kind of written off the situation and given him his meds and gotten out and really not dug in deeper to what he was feeling. But instead, I actually took the time to just listen and ask questions. And by the end of the day, he was really opening up to me. So the lesson that I learned was the importance of having empathy for others and attempting to understand their struggles, which I think is so important. The application for this is just remembering to take time to ask questions. So when working with youth in Nebraska for, establishing sexual education programs, we need to listen to what they actually need and what they want to learn instead of thinking that we have just one right plan that works best for them. Um, Being able to approach somebody the way that you would want to be approached goes a long way with kind of building that rapport with them. Change agent. Nebraska Methodist defines a change agent as someone who uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems, to develop cultural competence, and to take appropriate initiative to affect change. So, my first change agent experience was actually one of my very first experiences at Methodist. We volunteered at the Kuntz Commons food pantry. So, when I was volunteering there, I was able to help people walk through and pick out groceries, and then we also walked them out to their cars, to kind of help them load up and take everything that they'd gotten that day. And I was able to interact with so many interesting people. There were single mothers there that got all of their food from Coons Commons for the entire week. There were grandmothers that were there picking up food for other neighbors in their neighborhoods. There were Army veterans that were there to just kind of get a few things to help them get through. Um, so I really got to experience a lot of different individuals and cultures and populations in that area. The lesson that I learned is that it only takes one person to make a difference. I was surprised how many people, when I was walking them out to their car, we really had some very interesting conversations. And they were very impacted, as was I, with our interactions that we were able to have. So the application for that, um, is it only taking one person to make a difference. It only takes one person to apply for state or federal grants for sexual education. I'll talk about those a little bit later. Um, but by doing so, you can make a very large impact on a community, or in this case, on gonorrhea rates and sexual education in Nebraska, as just one person. My last change agent experience was at Jenny Edmondson Behavioral Health. We actually spent 2 days there in their behavioral health unit. And I was able to actually work with the patient that was experiencing anxiety, depression, and catastrophic thoughts. Um, he had admitted himself into the hospital because he was going through quite a bit. And I actually myself have experienced and struggled with anxiety and depression as well as catastrophic thoughts. So I was actually able to relate with him on a one on one basis, really, and kind of just share some experiences that have helped me that might help him. What I've learned from this experience was that change doesn't always need to happen on a large scale. As much as we want to impact large change, small one on one connections can actually mean quite a lot. The application for this is just remembering that each individual relationship we make can result in positive change. So, applying it to sexual education courses, yes, we want to establish programs that can help hundreds of thousands of youth in Nebraska, but we can't forget that it's those one on one connections that can actually make some real positive change in people's lives. Becoming an educated citizen, overall, this entire program has allowed me to become probably the best version of myself. It's pushed me to communicate and reflect and affect change in all facets of my life. The numerous experiences that I've had in clinicals throughout the entire year here, I'm definitely going to take with me and continue to apply to my nursing career as I learn and grow after graduation. And the knowledge itself of becoming, an effective communicator and a change agent and a reflective individual, that can all be applied to public issues, such as the issue of gonorrhea that we are, hopefully going to be able to make some headway on here in Nebraska. So, again, my public issue is gonorrhea. And addressing the rising rates in Nebraska. And as I said before, unfortunately, there's no current mandated legislation for sexual education in Nebraska. So, two programs that I found that I think would be quite helpful. One is the Teen Pregnancy Prevention Program, and the other is the Personal Responsibility Education Program. So, both of these, one's a federal and one's a state grant that you can actually apply for that will provide, thousands of dollars to an organization to help create a sexual education program in Nebraska. So I think it would just be so great if we could um, apply for these grants in Nebraska, and it can be different organizations working together. Maybe try to affiliate some connections with Planned Parenthood and Nebraska AIDS Project and other organizations around Nebraska that do free STI testing and free, education, and really utilize those funds that we can actually receive from the government to make a program that reaches a lot of youth and at-risk youth at that. The sexual education programs would be free of charge, utilizing obviously that state or federal money, and they can provide valuable education for at risk youth in Nebraska. So I think kind of using all of what we've learned as being an educated citizen and being a reflective individual and a change agent, and taking what is offered. There are programs and grants that are out there from the government that we in Nebraska to start taking advantage of. So being able to do that and focusing that energy and collaborating with those in the state that are already trying to affect change can be such a positive thing and have such a positive impact on our youth here in Nebraska and the public issue of the increased gonorrhea rates in Nebraska. So this last one here is just my references. And yeah, that's it. Thank you so much for listening. I appreciate it.